Well, it seems like you guys know a lot about Medicare, but I want to tell you one thing is when people come into my office, these are people that have been on Medicare for some time. And they don't understand it. They get a bill and they're not understanding why Medicare did not pay, different things. So this presentation is mainly for people that are almost new to Medicare, but you may learn something new from it. And most Medicare beneficiaries do. So I'll go ahead and start it. Medicare is very complex, so this presentation does not cover everything. As Connie showed you, this is the presentation that we train our volunteers on. And so it's very long and intense, and it's a lot of information. So Medicare has 4 parts. There's Part A, which is hospital, Part B, which is medical, C, which is a Medicare Advantage plan like a HMO or PPO that you can get, and Part D is for your medicine. And I'm going to go into more detail in a little bit. So most of the time, Medicare beneficiaries know that Medicare is automatic if you are receiving your Social Security check. So that will come automatically to you if you are receiving that check. If you are not, you have to enroll yourself, and you have to do that through Social Security, the website, or you can call them so that they can help you. A lot of people don't realize this, and I get people in my office that they were eligible for Medicare and they thought their card was going to come automatically, and they didn't enroll. So it all depends on where they are in the enrollment process. If it's late, then they could get penalized, and I'll go through that later on.
And why don't you tell Stephanie where our closest Social Security office is?
I know. And so what I can do, I do, because I cover 8 counties. I cover the southwest of New Mexico and part of Otero County. So what I do is I help Medicare beneficiaries if they're homebound or they just can't make it to Social Security. I can either go to them or I can help them over the phone, and we can work with Social Security that way. Because Medicare is so complex, sometimes people don't know what questions to ask. And so if I'm with them on the line, I think it runs a little smoother.
Now that's really something to remember. Besides the fact, Stephanie has what you call it backdoor numbers. So she can call sometimes, when you're on the phone forever and ever and ever and ever, waiting for somebody to respond to you.
Especially with Medicare, they respond to us very quickly, 3 seconds, somebody's on the phone. Wow. So if you ever have any issues with Medicare and you need to talk to them, get with me and we could do a conference call. I can meet with you.
Are you going to give your number?
I will. I brought cards. Connie's also here, so if you run into Connie and you need help, she can kind of get with me.
And I have my information here, so you can.
And I do a lot of outreach in Silver City, so if you run into me, I can meet with you then. Yes, ma'am.
Since you're speaking of phone numbers, that booklet that they sent me a few months ago, because I'm turning 65 in a month, anyway, maybe it might have been in the letter, it wasn't the booklet. There was a letter that Social Security Medicare sent me with the Las Cruces phone number, 800 number.
Yes.
So I keep dialing that, and all it says is, if you know your party's extension, enter it. If you don't know that, if you know the last name, put in, start typing that in.
Interesting.
And so,
if you could get me that number, I'd like to see the number just to see what it is.
If somebody else gave me a different phone number for the Cruces office, is definitely not what came out of that letter. And that one actually gives you a menu that you can choose to talk with somebody or whatever. But there's some screwy with.
Okay.
Well, we can follow up on that.
Yeah, we'll follow up with it. Yes, sir.
Just curious, President Obama once said he's going to bring 25,000 Syrian refugees to the country. Are they eligible for Medicare, or is this given a special dispensation?
That inappropriate question to me. I guess, we got so much time to cover, and I mean, unless you got a quick answer, Stephanie?
As far as refugees, I'm not sure, but if somebody comes in from, let's just say Mexico, they have to be a U.S. citizen for so long before they can qualify for this. Does it mean, do they have to have the working quarters? Usually. Some people can qualify if they don't, if they have limited income. So it's all on an individual basis. But as far as the refugees, I'm not too sure. So when to enroll in Medicare? So when it's your initial enrollment period, when you turn 65, you have 7 months to enroll. And what Medicare tells us is that you should enroll 3 months before you turn 65 so that everything is in place. And not just Medicare Part A and Medicare Part B. Medicare, if you want a Medicare Advantage plan or if you want Part D for your medicine, it's a good time to do it the 3 months because you don't want to delay in your coverage. Because if you have a delay, you can't get your medicine or anything like that. Because of the Medicaid expansion here in New Mexico, we have a lot of seniors that are on Medicaid. And when they turn 65 years old, the state takes away their full Medicaid benefits. And so a lot of seniors are not realizing that Medicare is considered coverage, that the state takes away their Medicaid, and they do not know that they have to get on this. So a lot of people are delaying it, and sometimes they're even going past their initial enrollment period. So then they have to wait for their general enrollment period, which is January, February, and March, for it to be effective in July. So you have to be real careful with that. So Medicare Part A, I could go on and on about all of this because under each one there's so much stuff that you need to know about. But if you want more information, I can give you the information, I can explain it to you. But because we have a short amount of time, I just want to briefly go through it. So Medicare Part A is hospital. So this covers your inpatient hospital, your skilled nursing facility, and you have to remember, original Medicare only covers the first 21 days in a facility. So after that, you have a big copayment. So a lot of people look at long-term care insurance, look to see if they qualify for institutional Medicaid. So when it gets to this point, you really want to look at your options when you are in a skilled nursing facility. Blood, if a person is on Medicare and needs blood, it's covered under Part A. Home health care, as long as the doctor says you need it, it could cover occupational therapy, speech therapy, nursing, skilled nursing in your home. The only thing that it does not cover is PCS, which is personal care services. So if you need somebody to help you clean, cook, bathe, Medicare does not cover that. Yes, ma'am.
On the inpatient hospital care, I know a lot of times when you go into hospitals, they admit you as an outpatient.
Mm-hmm.
So what kind of coverage do you have then at the hospital? If you're in a hospital, and I just think a lot of people think that they're inpatients, but it's not always the case.
Is that the observation issue?
Right. And so that was a big issue, the observation thing. When you go into the hospital, they put you in observation. But you are your own advocate. So when you are there, you don't really want to be under observation. You want to be an inpatient because then Medicare gets a little tricky with that.
Yeah, but the hospitals themselves, they code you in as an outpatient. So how do you get them to?
You need to talk to them. Unfortunately, that's what it is. So if it's something where they think that you're going to leave that day, they'll probably put you as inpatient. But if they're observing you and it's kind of like a waiting period, you want to make sure that you ask, because then Medicare gets tricky with that.
Yeah, I know. But I mean, the hospital, well, usually their answer is something like, well, that's just the way we do it.
Mm-hmm.
You can't really talk to somebody that has that kind of an attitude.
Yeah, that's correct. And if you have issues with that, I mean, you can call into, and I'm going to talk about it, our resource center. If you run into issues where your bill is not being paid by Medicare, we help with that. We talk to Medicare. We ask them, what could we do to help this individual if you do end up getting a bill that was not covered. So we do have resources to help people that if you get a Medicare bill, then we can look into it.
Keep this close. It's a good resource for you, for seniors. Real people answer that phone.
So 2016, some of the numbers did change for original Medicare. So if you are admitted into a hospital days 1 through 60, your deductible is $1,288. Days 61 through 90, you have to pay $322 per day. And then days 91 through 150, it's $644 per day. And then after that, it's all costs. So this is where people, when you're on Medicare, you kind of look to see what options are available to you. So Medicare Advantage, Medigap, and I'm going to go into that briefly. Medicare Part B this is your medical insurance. So this is what covers you when you go to your doctor's office. It also covers outpatient medical, surgical, and when you go for blood work, stuff like that, Part B is going to cover that for you. Clinical lab tests, durable medical equipment, you need a wheelchair, walker, cane, stuff like that, Medicare will help cover that. Remember, Medicare only covers 80%. So the 20% is your responsibility if you are on Medicare, original Medicare. Oftentimes people say it's traditional Medicare, but we refer to it as original.
That's the red, white, and blue card.
It also covers preventive services, and these are a list of services that you can get. I'm not going to go into detail. I do have a handout if you would like one, explaining when you can go get these preventive services. A lot of these, if you talk to your doctor, you can get these without having to pay a copay or a deductible when you see them for these particular services. But you have to let them know you are there strictly for that. If they start talking about your blood pressure and you're there for a breast cancer screening, they will charge you. So you have to be have a close relationship with your provider and say, this is what I'm here for. I will schedule another appointment for my other issues.
And then they will code it accordingly and Medicare will pay.
Yes, because you run into those, I run into them all the time where people said they went for their yearly wellness visit and Medicare is charging them. It should have been free, they say. But then you start digging into it, they started talking about other things. So they have to charge them.
Tricky. Don't ask them about the bunion on your toe when you're there for one of these things.
So services that are not covered by Part A and Part B is long-term care, like I mentioned. Original Medicare only covers 21 days in the facility. Routine dental care, dentures, cosmetic surgery, acupuncture, hearing aids, and other stuff would be like glasses. Medicare does cover if you have glaucoma and you need surgery, or cataracts and you need surgery, Medicare will cover one pair of glasses. So if they think you're going to get one in the other eye, I would wait so that you could get that pair of glasses, you know, for your eyes. Other than that, they're only going to give you that one pair. So you do one eye, they're going to give you the glasses, and then you need the other eye, they're not going to cover it.
Are you saying one pair of glasses for the rest of your life?
Pretty much, if you have cataracts. Okay, so 2016, the Medicare premium did change, okay? So before 2016 was here, the premium was $104.90. And that was either being deducted from your social security check or you were paying that monthly. So some people, well, actually the 2016 premium now is $121.80. And these are the 5 groups that are going to be charged this amount. So if you are on Medicare and your premium was being deducted from your social security check, your premium will remain $104.90. If you are new to Medicare, then you will pay the $121.80. And if you're not getting it paid through Social Security or your railroad retirement, if you are retired from the railroad, then they will charge you the $121. Also, if you have both Medicare and Medicaid, they are going to charge the $121. So this includes full Medicaid, and it also includes partial. So if you have the QMB, which is Qualified Medicare Beneficiary, qualified individual, which is QI, or Slim B, which is specified low-income Medicare beneficiary, then you will be charged the $121.80 because the state is picking up your premium.
Now, can this change next year?
Yes,
Okay, that's what I thought.
it
Every
can.
year.
And also,
Stephanie, quick
yes.
question?
yes,
Well, it's not a question, but clarification. Yeah, if you're on Social Security and there is no increase in Social Security, there's no COLA, then they can't increase your Medicare because the basic law says that your Social Security cannot be increased.
That's why we aren't increased now. We're already on it, so we're not increased,
That's
yeah.
correct. If you're already
Okay.
on it, that's why you're still paying.
Okay, but who knows, maybe next year they'll change something, right?
No, that's a law.
Okay, it's a law, all right, good.
Since the 70s.
Okay, so if there's no increase in Social Security, there's not gonna be an increase in the premium for, okay, gotcha.
so those people that are due to Medicare, if you're gonna become Medicare eligible this year, next year, this is gonna be your premium. And if you are on Medicaid and if your premium's not being deducted from Social Security, this will be your premium. Okay, so you have choices when it comes to Medicare. You can stay on original Medicare, Medicare Part A and B, which is medical and hospital. And then you pay the 20% because we all know Medicare only covers 80. And then you have options. So you can see here, you can get a Medigap, also known as a supplement, or you can go and get a Medicare Advantage plan, which is also known as Part C. So this is kind of where you weigh your options. And I'm going to talk briefly about it, but if you have more in-depth questions, then I can answer it after. So Medicare Advantage plan, these are plans approved by Medicare, and they let certain companies run these plans. You still have the same rights and protections as you do with Medicare. The only difference with these is that you are limited to where you can use it. So they are limited to your service area, and they are also limited to who takes it or who doesn't. So if you live here in Silver City and you have a Medicare Advantage plan, and you want to go to Mayo Clinic in Arizona, more than likely they're going to deny it because you are restricted to your service area. These also offer some vision, some dental, and some hearing in it. And that's why a lot of Medicare beneficiaries kind of tend to go that way because it does add those benefits. But they're limited. It's not comprehensive. So you're going to get a vision screen, dental cleaning, but it's not going to be comprehensive.
May I add here, Stephanie? I did visit with Healer Regional yesterday. We have only a couple of Advantage plans in our area. I don't know if any of you have selected an Advantage plan for your coverage, but that means you no longer use your red, white, and blue card. You use the new Advantage plan card, and there is United, which they sometimes say is AARP. It's Medicare Complete. That's one of them that's available here, and they are under contract with the hospital, which means that you would be in network if you are part of that plan. And there's a Presbyterian plan that they are in contract, under contract with. They are not under contract with Humana. And if you have the Humana Advantage plan, you need to call the back of that card and do some checking to make sure you know everything is okay for this area of the country. That's really important. Yes.
She mentioned that you can't go outside of your area, and I've had other people tell me that, but that's not true. Because I did have an Advantage plan, and I did have cataract surgery in Tucson. I also had skin cancer treatment in Tucson with the Advantage plan. There are ways that you can go out of your area.
Which Advantage plan was it?
United.
United. So the great thing about United is that they offer the passport on that plan. So which means if you are traveling or if you need to go somewhere, you have to get with that specific plan. Not all the plans offer it. Like Humana doesn't offer it, Pres doesn't offer it, but United does. It's the passport plan. So if you need to get work done somewhere, you have to get prior approval through the plan. so that they can approve it for you.
So I think whenever Stephanie sends me out somewhere, or I'm asked to talk to anybody, my standard is know what you have. Know what you have. I can't tell you the people that come in that get for medication assistance, and I'll say, well, do you have, what's your insurance? Well, I don't know. And then they say, oh, no, I don't have an Advantage plan, or I don't have a Part D plan. And pretty soon they're digging through their billfold and, oh, yeah, I do. Yeah, I guess I do. So know what you have. With that particular case, I have talked to their representatives, and they will negotiate and help you get coverage outside of where their standard location is. But you still got that issue you've got to think about.
They tried to tell me I couldn't, when I called the
Yeah.
representative, and I said, no, you need to look at the policy.
Good for you. Good for you. But you have to be, the point Stephanie's been making too, is you have to be your own advocate in a lot of these situations, and she has helped a lot of people override those. Yes, quick question.
Is TRICARE limited too?
No, TRICARE, you are home free.
Yes, you are.
Okay.
Okay, so Medigap. I just want to bring up a good point. I do Medicare open enrollment in all the 8 counties that I cover, October 15th through December 7th. This year in particular, I had a lot of people, especially in Las Cruces, poor individuals in particular, that had a Medicare Advantage plan, and they've had it for a good 3 years. And a lot of them got sick. One individual was very upset because he got cancer. And the only place that could treat him was in Arizona, and his plan did not want to cover him at all. And so he was very upset. So he wanted to get one of these, which is a Medigap. These are taken nationwide, so no matter where you go, this will cover that 20%, depending on what plan or policy you choose with the Medigap. And those get a little more complex, but if you want to know more about it, I can educate you on it. But just to bring it up, because he was in a Medicare Advantage plan, and he did not enroll in a Medigap when he first turned 65 years old, these Medigap plans will ask you what your pre-existing condition is. A lot of you think that the law says that they can't do that. With Medicare, with Medigap, they can. So this individual, because he was diagnosed with cancer, a lot of them were denying him. So then he was limited to what do I do? We were able to find one plan that covered him, but his premium was close to $300 a month, but he needed it. So it's just, you have to really look at your options. You really have to, when beneficiaries come in and they're new to Medicare, I do my best to lay everything out on the table and educate them as best as I can so that they can make the best decision possible. But there's always some things that happen, and that's why our agency, the Aging and Disability Resource Center, is there. I'm here, Connie's here. If you ever run into problems with your insurance, please reach out to us so that we can help you. These Medigap policies are run by different companies, and they cover the gaps of Medicare. So Medicare covers 80, this will pick up to 20 depending which plan you go with. So there's different plans, A, B, C, D, F, G, K, L, M, and N. The ones that people tend to go with are G and F, okay? And those two are more comprehensive. They cover more of the gap. So if you want more information, I can definitely give you that after I'm done here.
This is sometimes called supplemental.
Yes, ma'am.
If you can't find a company to take you with any of these plans, is there something else that you can do? I mean, if you're not 65, you can go into the assigned risk pool. Is there such a thing for the over 65 group?
No.
So you're just
It's either you have
SOL.
original Medicare, your supplement or Medigap, or the Medicare Advantage plan. So, and then there's some people that did not have enough working orders, and they can't qualify for Part A or Part B. So those people are kind of going into the marketplace. When the marketplace started, we had a lot of issues. Those people were falling in the gap, and they didn't have coverage. So now the government is realizing those people do exist, and they need coverage. So they're being able to put them in the marketplace plans. Okay, then Part D is for your medication. I want to bring something up that I didn't bring up. If you did not enroll in Part B when you were supposed to, or you thought you had credible coverage and you didn't, the government will penalize you 10% of the national premium for every full uncovered year that you were not enrolled in Part B. So it's very important to look at that. I have a lot of people come into my office, oh no, I don't want Part B because...
You mean D?
No, I'm talking about Part B right now.
Okay.
But B because they can't afford it.
Okay.
And I have to explain to them that there is a penalty. It is your option to take Part B, but if you don't, there is a penalty. The same with Part D. People say, oh, I don't take medication right now. Why do I need a Part D? Well, it's very important. The government will penalize you for every month that you are not covered. So right now, the national premium is about $34. They charge you 1% of $34 for every uncovered month. So this can add up too. So this is very important to get. If you get a Medicare Advantage plan, Part D is included in that. If you go with original Medicare, or if you go with a supplement, you would get a standalone drug plan. It's very important that you look at the coverage with your Part D. That's why Medicare gives you your Medicare open enrollment period, October 15th through December 7th, to compare your drug plan. Because every year, the plans change, the tiers change, the formularies change. And a lot of people don't realize it, and they end up falling in the coverage gap or the donut hole. And the cost of the medication is extremely high. So that's why MAP is there. That's why we have a prescription drug program to help people that fall in that gap because of their plan. Yes?
I have a comment and a question.
Yes,
The
ma'am.
comment is, some medications don't have generics. And even though that's the only thing that you can get, in my case it's insulin, you still have to pay the higher copay. And I don't think that's fair. That's the comment. The question is, I have, my primary insurance before Medicare is Blue Cross Blue Shield from the feds. That now is my secondary, and that's where my drug coverage is. I don't think that I'm being charged or would be charged by Medicare for not having Part D. Is that correct?
As long as it's considered credible coverage. So their definition is it has to be as good as Medicare or better. So there are some insurances that it could be a Blue Cross Blue Shield plan and it's not credible. I had a gentleman come in my office and he was trying to get a drug plan because he was retiring, and he didn't realize that his insurance wasn't credible. And that was, I think it was 6 years later.
Well, credible has to be, like if you're quitting your job and retiring or whatever, you need to get a letter. You need to have something in writing that says you have had creditable coverage up until this point. So you just, and even later you could get that letter probably, but keep that in mind that you need to be able to prove that you did have coverage so you don't get penalized.
Well, I would just make a comment because I'm perhaps in a unique position because I'm a retired minister, but I get a list yearly from Express Script or Script Express
Right.
showing what is available in generic and what is not.
Right. Right. No, Express Scripts is they cover a lot of companies like your pension would choose Express Scripts, yeah.
Okay, so then I talked about the donut hole. I talked about the premium for Part B. There are some programs that help people with limited income and resources. So there is Medicaid, the Medicare Savings Programs, and Extra Help. Medicaid is a little difficult. A lot of people want the personal care services in their home. They want to be able to have their Medicare and Medicaid, which you can. You could be dual eligible. But the only way that you can get that Medicaid, the full Medicaid, there's only 3 different ways. When you are 65 years old, it's much harder. So the only way to do it is if you are in a skilled nursing facility, you have to be in there for 90 days to qualify for institutional Medicaid. And then after the 90 days, you can go home with full Medicaid benefits. And that would bring in the personal care services in the home. The next one would be if you are an SSI recipient, supplemental security income. So if you are receiving 2 checks from Social Security, you automatically qualify for the Medicaid. The next one would be the Resource Center. I handed out a brochure. There is it used to be called the COLPS Medicaid waiver, now it's just called the Medicaid waiver. And basically what it is a wait list for people who want to put their name on the list to qualify for the full Medicaid. It is a long wait list. But if somebody is in dire need, they're by themselves, cannot take care of themselves, and need that, it's a possibility that they can get allocated off that list and get the full Medicaid benefits. But you do have to meet the income limits and resource limits for that.
And I told Stephanie, probably this audience, there might not be anybody that would be considering those things, so we made this very brief.
And then the Medicare savings programs, there's 3 different programs Medicare beneficiaries can qualify for to get the Part D premium paid for. So if you think you might qualify, you can meet with me after and I can definitely screen you to see if you qualify. And then the next thing is extra help. With your Part D plan, if you meet the income limits, it limits how much you pay on your medication. It also limits if you have deductibles and how, what tier your medication is on, it'll limit how much you pay. So it could be around $6.50, not more than that, and the less amount you could pay is $0. So this is a great program, all 3 of them. If you qualify, I would definitely look into that.
5 minutes left.
Wow.
I'm gonna make this real fast. Marketplace. A lot of people that are new to Medicare are on the Marketplace plan, and they're like, I just want to keep that. And it's like, you do have the option to, but then there comes the penalties if you do not take Medicare. You do not get those tax incentives if you are eligible for Medicare and stay on the Marketplace plan. So it's very important to look at that. It is illegal for someone to be on Medicare and Medicaid Marketplace at the same time. So it's important to look at all your options. If you have questions, the Resource Center is there, or you can reach out to Connie or myself. Let's see, your Medicare Summary Notice. This is very important to look at. It helps you identify Medicare fraud, protect, detect, and report. We do a lot of this at our Resource Center, where people say that they were misbilled, the doctor on there wasn't the doctor they saw, different things like that. If you get a bill and you don't think it's your responsibility, ambulance especially is a big issue, reach out to our center. We do have somebody available that can reach out to Medicare and see why it wasn't paid or why there's fraudulent charges on there. And then the Aging and Disability Resource Center, just to make it brief, you have the brochure. It is a call center, open Monday through Friday, 8 to 5. It's people like me, just on the phone. And if you have any questions about anything in there, please reach out to the Resource Center, and they will be more than happy to help you.
Wow, how many minutes now?
Can I take 1 minute?
Sure.
It's about the bill. I would be more than happy to go through my bill, but it says numbers. It doesn't tell. I could have a prostate exam, and I wouldn't know it, and they would charge me.
Right. So if you wanted, I could probably get you a list of the numbers. There's a lot of numbers, but if there's a specific number and you just want to check it, reach out to me. All I need to do is call Medicare, and they'll give me what it stands for, and I can give it to you.
Wouldn't that be on the internet someplace?
Yeah, I'm sure you could find it on the internet. But if you wanted to reach out to us, I could help you.
Can I have your name and number?
I do have cards, so
Cards.
if you would like one, I will give you one. I do have to tell you though, the Resource Center is my best friend because I cover 8 counties. I'm in my office maybe once or twice a week. So I do a lot of outreach, I do a lot of education, I do a lot of one-on-ones. I'm at the senior centers, so it's really hard to reach me, but if you really do want to talk to me, leave me a voicemail if I do not answer.
So we'll have cards here, and we'll have my little brochure and with my numbers.
So, just to clarify, because I think I got a little confused when I
It's a
thought I
lot.
wasn't. when you get Medicare,
Mhm.
you have the option of either getting a Medicare Advantage program or a Medigap,
Correct.
either or of those with Medicare.
Right.
How does it work for a person who's a VA covered person? I know VA is considered credible coverage, but
Right.
at the age of 65, obviously, you need to apply for Medicare. How does that relate then, where the Medigap comes in, if you just choose to be VA and Medicare, and then at some point you decide you want to do a Medigap on top of that?
I'm gonna say that's a very specific question with the VA question, so if Stephanie,
Yeah.
can you talk to her
Sure.
for a minute when we're done?
Sure.
Okay.
Just one quick comment. I signed up for Social Security in August, turning 65 in September. I didn't drive anywhere. I just went on the internet. It was relatively painless. If you screw up, just back out and go in again.
Okay.
Don't drive with those cruises.
Good. 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 Carol.
Just, I think you're my mom, she's if I have a question, do I pretend
No, you don't want to do that.
Did you hear the question? Do you, because they won't talk to you, right? If you're talking for somebody else, does she pretend to be your mom? She says no.
I have power of attorney.
Okay, if you have power of attorney, then you can say I'm power of attorney. It depends who you call. For me, if somebody calls me and it's a child and I ask for the social security number, date of birth, all of that, I want to hear from the person. And if they are power of attorney, I want to know that. Because I don't want to give information to someone I'm not supposed to be giving information to.
Right.
So it's just important that, you let them know who you are.
That's what I've done in the past when she was able to get on the phone and say, this is my daughter, can you just talk to her?
Right.
And she can
Of course, that could be anybody too, so.
Yeah, that's true, but I was just.
I actually have done that.
Easier. Right. That's probably the only.
Unfortunately,
Yeah.
though, I run into, I work with the state and I have a problem. I work with the state, and then you give me this and this. No, I need to hear from the person first. So it's just everywhere, and it's just identity theft, all of that.
Okay, Rebecca, you're giving us high signs.
Continue, you didn't finish, you only have 2 slides.
No, that was just the resource center, so we're good.
Okay, great. Okay.
So now we've been doing questions for a while already, Rebecca, so can we,
Let's do more questions. Yeah.
Okay, well, what I'm gonna say is that we won't be able to do the senior issue piece. I know, and that's really important to me too. So, can you, those of you who have questions about Medicare, can you give us a few minutes now to do the senior issue thing? And then if you have a specific question, can you ask us, can you stay a minute afterwards? Is that a kind of a compromise? Because I really want to do really quickly. I'm not going to take time to pass it out, but I do have my SHIP information. I have a brochure on Silver Adult Care Services, which is trying to work out respite for caregivers for seniors at our senior center. And so I have a brochure on that, so you can pick one of that up. There's a caregiver refresher class that started Monday. There are 6 more classes, and they're very worthwhile and free. And I have a few brochures on that. So if you wanted to look at that, please do that. So, senior services. We now have in our little community a representative on the Area Agency on Aging up in Santa Fe representing our county. And it's Krista Bolt. And the job, if you know, senior services in this town is pretty much covered and run and administered by the county, reluctantly. They really don't want to do that. So all of our senior centers are under the county. So we need to get more involved and work on senior services in our area. So my plan was, which is probably not going to happen, but was to get from you what you think, what senior services are on your mind that you think our county needs that I can pass on to Chris. That was my plan. I have a whole list of services that have been lost over the years to our community. I have a list of things that people think we should have and things that we do have that should be better, but I want to hear from you. What services, just throw out some services that I can pass on that you want in our community that you don't think we have or that it should be better. Anybody? Yes?
Well, how about, my husband goes to Las Cruces once a month for a shot in the eye for macular degeneration. And if we could get somebody coming in here once a month.
Okay, so what would that be? Specialist, eye specialist?
That was a macular.
Okay.
Macular doctor.
Yeah, specialties, that's a real issue, so,
Yes.
but why couldn't they do that? You know? I've often looked, why can't they do telemed? But they couldn't do that way, so, yeah, bring in specialists, good. Another one. What do we need?
Adult daycare.
We need adult daycare. We're working on it, but it's tough. So pick up a brochure if you want to know more about that.
Why can't someone from Social Security come here?
Good point. Could come up and maybe say, I'll be at the senior center. Okay, regular Social Security rep coming to.
And I want to add something on that. Unfortunately, the government says they don't have money for people to travel. Because I would always like a Social Security rep to come with me if people had Social Security questions, but they said no. But I do have a Social Security contact, but that's it.
We put it on the wish list though.
Yeah.
Another idea. What do we need?
What about Skyping? Skyping something like that, instead of traveling.
Put that on the, yeah, Skype. Yeah, good idea.
That is a very good idea.
Yeah, why not? Good idea. Throw it out. What do we need? Do we need any more nursing homes? Do we need any assisted living
I
places?
don't know what we have, so I don't know.
Oh, well, throw out what you'd like to see here, and I'll tell you if we have it. You know, we've lost, go ahead.
Some type of volunteer center. I've been trying to find out how to volunteer for people who are homebound and who need somebody to buy groceries for them.
You want to be the volunteer?
Yeah.
Turn around, Meryl, and get her
No,
name.
I mean, I'll volunteer.
That's what I mean. We need your name. No, we have a volunteer center. But what has happened with our volunteer centers, they go where the money is. I mean, so they are doing other issues. They are not really a gathering of volunteers. But if you get a hold of them, I'm sure they could give you some ideas of, we do have a volunteer center. Have you tried that? Okay. Okay.
How about assisted living centers?
Yes.
We have to read.
Care.
What? Continuum of care, you mean, where you start and have independent housing and then you know, can go all the way up to hospice. Continual care. Huh? What more?
Marty wants.
Yes. They're working on it. Bridge community.
Yeah.
Other ideas? Come on, anything.
Cooking and cleaning.
Okay, homemaking, housekeeping services. That brings me to mind the caregiver list that the hospital will, if you go to the hospital, they have a discharge planning, has a caregiver list. It's not vetted, but it's there because a lot of times you want somebody to be able to come in and do some, you know, respite care for you or, okay, other ideas.
Don't we have community in-home care here in-home care?
Yeah, we have Horizon Home Health, coordinated care, is that still here?
Well, the one that does in-home cleaning, cooking.
Angel Wings is one.
But they're little.
That's a need, Amber Care would like to add that into their hospice, but they haven't yet.
What about the resource directory that we used to have?
Yeah, when you talk about lost senior services, you know, yeah, senior life cycle is what I did for 10 years and that's gone. So, you know, things come and go, ebb and flow, you know, but you know, if I could say, oh, 50 people, how many people we've got here, 30 some? You know, we had took a list and here's what, some of the things we want. See what you can do about it. Any other ideas?
A pedicure. Yeah, like a pedicure.
Oh,
That's one thing my mom, she can't reach her feet very well.
you know about the foot clinic at the senior center on Tuesdays?
Oh, no. Okay.
Yeah, we'll talk about that. There is a Sherry Bassey at WNMU does a foot clinic at the senior center.
They also do their,
Right, I know what you said.
yeah,
Yeah. What? Yes, gospel mission. She also goes there, you're right. She does it in both places.
Probably more public transportation for people that can't get out easily.
Okay, we used to have a senior route with Caminos, and that had to go away because of funding. I think somebody, a gentleman I picked up said that he can get passes for Caminos as a senior, so I need to look into that. Yeah, we need to do a better job of utilizing Caminos, I think.
There are Meals on Wheels here.
We do have Meals on Wheels, we do have it, so.
Is there a listserv for just seniors in Grant County?
Put that down. That'd be kind of neat. We have a really pretty good one with the community, the Health Council's community calendar.
Yeah.
But you're right.
If it were something that said that Stephanie were coming on these days this month, or the foot clinic, or things specific, you look at it and say, oh yeah, I don't need that this month, or oh my gosh, I forgot all about that. I just think it would make more sense to focus.
You know, I think it used to be even in the paper, a little senior section. I've seen it in cruises, I think. You know, so yeah, let's have work on that. Listserv, yeah, that's good.
We used to get that senior newspaper that came from cruises.
Yeah, and there was one also that was put out, I forget her name, out in Members in the valley, and that was a senior. But that publication's gone.
One more on the list.
One more.
Nancy.
Oh, you answered it.
Okay, is that it? Okay, well, I have a lot of lists of things too, and I'll add it to this, and I will pass it on to Chris.
All
Any
right.
other questions?
Thank you.
Ooh, good
From
job.
Lunch and Learn 2016, my co-coordinator, Sonny Salcillo, is here, and we wish to thank you all for these wonderful nooners. Thanks for coming.
Okay. Thanks for coming.